Retatrutide, the first triple hormone receptor agonist. In the history of obesity medicine, few compounds have generated as much scientific excitement as retatrutide. Developed by Eli Lilly and Company and also known by its research designation LY3437943, retatrutide represents a fundamental leap forward in the pharmacological treatment of obesity and metabolic disease. Where previous breakthrough drugs targeted one or two hormonal pathways, retatrutide simultaneously activates three distinct receptor systems, producing weight loss results that, for the first time in the history of pharmacotherapy, begin to approach those achieved by bariatric surgery. To understand why retatrutide is so extraordinary, we must first appreciate the complexity of the hormonal systems that govern body weight and metabolism. The human body regulates energy balance through an intricate network of hormonal signals, and three of the most important are glucagon-like peptide 1, glucose-dependent insulinotropic polypeptide, and glucagon. Each of these hormones plays a distinct and critical role in metabolism, and each acts through its own specialized receptor. Retatrutide is engineered to activate all three simultaneously, a feat of molecular pharmacology that produces effects far greater than the sum of its parts. The first pathway is GLP-1 receptor agonism. GLP-1, or glucagon-like peptide 1, is a hormone secreted by specialized cells in the small intestine called L cells in response to food intake. When GLP-1 binds to its receptor on pancreatic beta cells, it triggers glucose-dependent insulin secretion, meaning insulin is released only when blood glucose is elevated, dramatically reducing the risk of hypoglycemia. GLP-1 also suppresses the inappropriate release of glucagon from pancreatic alpha cells, slows gastric emptying to prolong feelings of fullness, and signals the hypothalamus in the brain to reduce appetite. GLP-1 receptor agonists like semaglutide have already transformed obesity treatment, achieving approximately 15% body weight loss. Retatrutide builds on this foundation. The second pathway is GIP receptor agonism. GIP, or glucose-dependent insulinotropic polypeptide, is secreted by K cells in the upper small intestine. Like GLP-1, it enhances glucose-dependent insulin secretion and promotes glucose uptake in peripheral tissues including muscle and fat. GIP also has anti-inflammatory properties and plays a role in regulating fat storage and energy homeostasis. The combination of GLP-1 and GIP receptor agonism, as demonstrated by tirzepatide, produces synergistic effects on weight loss, achieving approximately 20 to 22% body weight reduction. But retatrutide adds a third dimension. The third pathway and the key differentiator of retatrutide is glucagon receptor agonism. Glucagon is a hormone produced by pancreatic alpha cells that is best known for raising blood glucose by stimulating the liver to release stored glucose. This might seem counterproductive in a diabetes or obesity drug. However, glucagon receptor agonism also has powerful metabolic effects. It dramatically increases energy expenditure through thermogenesis, promotes lipolysis, the breakdown of stored fat, and decreases lipogenesis, the creation of new fat. The critical insight behind retatrutide's design is that the hyperglycemic effects of glucagon receptor agonism are fully counterbalanced by the insulin-stimulating effects of GLP-1 and GIP receptor agonism. The result is a net metabolic benefit: increased energy burning and fat breakdown without the dangerous blood glucose elevation that glucagon alone would cause. This elegant three-way balance is the pharmacological genius of retatrutide. It does not merely suppress appetite and slow gastric emptying like GLP-1 agonists alone. It does not merely add insulin sensitization like dual GLP-1 and GIP agonists. It adds a third engine of weight loss: increased metabolic rate and accelerated fat breakdown, creating a compound that attacks obesity from three distinct biological angles simultaneously. Structurally, retatrutide is a synthetic peptide based on the backbone of native GIP, with strategic amino acid modifications that enable it to bind and activate all three receptors with high potency. It is administered as a once-weekly subcutaneous injection, injected into the fatty tissue of the abdomen or thigh, and follows a careful dose escalation protocol. Treatment begins at 2 milligrams per week and increases every 4 weeks through 4 milligrams, 6 milligrams, and 9 milligrams, with some protocols continuing to a maximum dose of 12 milligrams per week. This gradual escalation is designed to minimize gastrointestinal side effects during the adaptation period. The clinical evidence for retatrutide's efficacy is nothing short of remarkable. The landmark Phase 2 trial, published in the New England Journal of Medicine in June 2023 by Jastreboff and colleagues, enrolled 338 adults with obesity but without diabetes. Participants were randomized to receive placebo or one of 4 doses of retatrutide, 1, 4, 8, or 12 milligrams weekly, for 48 weeks. The results were extraordinary. At the highest dose of 12 milligrams, participants lost an average of 24.2% of their body weight at 48 weeks. And critically, the weight loss curve was still descending at the end of the trial with no plateau in sight. Waist circumference was reduced by up to 19.6 centimeters at the highest dose, compared to just 2.6 centimeters in the placebo group. To put these numbers in context, this degree of weight loss had never previously been achieved by any pharmacological therapy. It was comparable to the results of some bariatric surgical procedures. The Phase 3 program for retatrutide, known as the Triumph and Transcend programs, has expanded these findings dramatically. The Triumph 4 trial, results of which were announced in December 2025, enrolled 445 adults with obesity and knee osteoarthritis, a population where excess body weight directly causes joint pain and disability. After 68 weeks of treatment, participants receiving the 12 milligram dose of retatrutide lost an average of 28.7% of their body weight, equivalent to an average of 71.2 pounds. Among those receiving 12 milligrams, 58.6% achieved at least 25% weight loss, 39.4% achieved at least 30% weight loss, and 23.7% achieved at least 35% weight loss. These are numbers that overlap substantially with the outcomes of gastric bypass surgery. The effects on knee osteoarthritis pain were equally dramatic. Retatrutide reduced WOMAC pain scores, a validated measure of osteoarthritis pain, by up to 75.8%, compared to 40.3% in the placebo group. 14.1% of patients on the 9 milligram dose were completely free of knee pain at the end of the trial, compared to just 4.2% on placebo. Physical function improved correspondingly, with reductions in the WOMAC physical function subscale of over 71%. In the realm of type 2 diabetes, retatrutide has demonstrated equally impressive results. In the Phase 2 diabetes trial, retatrutide reduced hemoglobin A1C, the primary measure of long-term blood glucose control, by up to 2.16% at the highest dose, compared to 1.36% with dulaglutide, a standard GLP-1 agonist. The Phase 3 Transcend T2D1 trial, results of which were announced in March 2026, confirmed these findings, with A1C reductions of 1.7 to 2% across doses at 40 weeks, meeting all primary and key secondary endpoints. Beyond weight loss and glycemic control, retatrutide demonstrates a broad spectrum of cardiovascular and metabolic benefits. In clinical trials, it significantly reduced non-HDL cholesterol, triglycerides, and high-sensitivity C-reactive protein, a marker of systemic inflammation. At the highest dose, it lowered systolic blood pressure by 14 millimeters of mercury. These cardiovascular risk factor improvements suggest that retatrutide may have benefits extending well beyond weight reduction, potentially reducing the risk of heart attack, stroke, and other cardiovascular events in high-risk populations. The therapeutic applications of retatrutide extend across a remarkable breadth of conditions. 8 Phase 3 trials are evaluating its efficacy in obesity and overweight, type 2 diabetes, knee osteoarthritis, obstructive sleep apnea, metabolic dysfunction-associated steatotic liver disease, also known as MASH, cardiovascular outcomes, chronic low back pain, and renal outcomes. This breadth reflects the fundamental role that obesity plays as a driver of so many chronic diseases, and the potential for a highly effective weight loss therapy to address multiple conditions simultaneously. Regarding safety, retatrutide's profile is broadly consistent with other incretin mimetics. The most common adverse events are gastrointestinal in nature and dose-related. Nausea occurred in 38 to 43% of participants at the highest doses compared to 10.7% with placebo, diarrhea in 33 to 35%, constipation in 22 to 25%, and vomiting in 20 to 21%. A notable side effect specific to retatrutide is dysesthesia, abnormal skin sensations, which occurred in 8.8 to 20.9% of participants but was generally mild and rarely led to treatment discontinuation. Importantly, because retatrutide's insulin-stimulating effects are glucose-dependent, the risk of hypoglycemia is very low. Overall treatment discontinuation rates due to adverse events were 12 to 18% at the highest doses, compared to 4% with placebo. As of April 2026, retatrutide has not yet received FDA approval, but with multiple Phase 3 trials reporting positive results and additional readouts expected throughout 2026, regulatory submission and potential approval appear to be on the near horizon. The expected price, once approved, is estimated at approximately $1,200 to $1,600 per month, consistent with other medications in the GLP-1 class. Retatrutide stands at the frontier of a new era in metabolic medicine. For decades, the treatment of obesity was limited to lifestyle interventions, older medications with modest efficacy, and bariatric surgery, a highly effective but invasive procedure available to only a fraction of those who could benefit. The emergence of GLP-1 agonists changed this landscape dramatically. Retatrutide may change it again even more profoundly. By harnessing three complementary hormonal pathways, appetite suppression and insulin sensitization through GLP-1 and GIP, combined with enhanced energy expenditure and fat breakdown through glucagon, retatrutide achieves weight loss outcomes that were previously thought to require surgery. For the hundreds of millions of people worldwide living with obesity and its devastating complications, retatrutide represents not just a new drug, but a new paradigm. For educational purposes only, retatrutide is an investigational compound not yet approved by the FDA. Always consult a qualified healthcare professional before considering any medical